Good morning, sir.
Good morning.
How are you doing today?
I'm fine, thank you. How are you doing?
I'm good, sir. May I know your name, sir?
Yeah, I'm Dr. Ashish Das. I'm senior consultant neurologist in PLS Hospital. It is a multidisciplinary hospital in Kolkata.
Okay, all the way from Kolkata just to attend the
I'm
conference.
from Kolkata to attend this conference actually. Yeah.
So, since we all know that it's a month of awareness for epilepsy, so epilepsy, although it's a very wide topic to talk about, and we have a lot of patients every now and then that we encounter nowadays.
Right.
So, what is the message for the people who are taking care of the patients, having epilepsy? You would like to give it to them?
Yeah. Yes, it is a common problem as we know that the incidence is around 1% and prevalence is 3%. So, I think conservative estimate in India alone there are about at least 1 crore epileptic that are active these days, and the better part is that though there are lots of myths and misconceptions about epilepsy and so on, it is a definite treatable conditions and it has got a definite structural, organic and metabolic basis, and by careful selection of patients and careful history and few investigations you can make a diagnosis in more than 80% of times. And with this present armamentarium, that is the mainstay of anti-epileptic medications, about 75 to 80% of patients of epilepsy can be treated quite well with medications, and they can live a normal life just like other people of the age-matched people. So it is essentially a treatable conditions, nothing to do with devil or exorcism kind of thing. So if someone suggested us there is suspicion that he or she might be suffering from epilepsy, it is always preferable to send the patient to a physician or neurologist for early and proper treatment so that ensure a good quality of life.
All right. So, like you just mentioned, what exactly they should be doing. But apart from that, we all know that doctors recommend keto diet for the patients suffering from epilepsy.
Yes.
But I would want to ask you, what are the things they should avoid eating?
Yeah, fortunately, as far as epilepsy is concerned, except for the rare, very, very rare genetic or metabolic epilepsies, where in particular, I think metabolic product is accumulated in the body. Apart from that, by and large, most of the patients with epilepsy can have normal diet, and most of the people do. Most importantly, they should not fast actually. It is the deprivation of food, or there is hypoglycemia, that if they are deprived of food or there is ritualistic fasting, that can actually induce seizures rather than the type of food they take. So they can take any kind of food, only they have to ensure that they don't have fast for a prolonged hour kind of the day. Otherwise, there is no restriction of food except for the rare genetic conditions, which is less than 1% of cases, where they might have to avoid certain like protein-rich foods in methionine deficiency things and so on. By and large, it is a normal food stuff as other people used to take.
So, are you saying between breakfast and lunch, if there is a time span of 4 hours, that shouldn't be? They should be having some mid meal.
It is always better to take some snacks kind of thing, and there is no fasting for suppose 12 hours, ritualistic, religious fasting. It is not recommended. So it can strong, I think, inducer of seizures. Okay. So if you are any kind of epilepsy syndrome, so it is always ensured that you don't have to fast and deprive of food for a long time actually.
Sure. Thank you so much for your words, sir.
Thank you. Thank you very much. Yeah.